There is an HIV prevention emergency in the United States today, but you won't hear any of the federal officials who have been charged with managing this epidemic issuing a call to action anytime soon. And so today, members of the communities that have been most deeply scarred by HIV and AIDS are issuing that call. Every year in the US, there are 50,000 new infections with HIV. That number has been steady for a decade, a statistic that seems to describe an epidemic that is under control. The reality is different. Among all ages of gay and bisexual men and transgender women, the epidemic is, according to the latest figures, on the rise, and sharply on the rise for young gay men, especially young gay men of color. Very recent data say that here in Atlanta, in a single year, 12% of young gay black men become infected with HIV, a rate of infection unseen in any wealthy nation except ours. Even in communities that have enjoyed lowered HIV incidence in recent years, such as injection drug users, there is cause for concern. A heroin epidemic, much of it suburban, is pulling in a brand new generation and putting it at risk, at special risk for HIV. Workers in the field tell us that although new infections among women have dropped, among women at particular risk, either because they are in abusive relationships or homeless, or we've neglected them in some other way, there is no drop in infections. We activists are here in Atlanta today, the home of the Centers for Disease Control and Prevention, to tell the federal healthcare bureaucracy that an epidemic without end is not acceptable. We have the means to end it. Treatment of people living with HIV promotes prevention by lowering the amount of virus in a community. There is a new one-a-day pill that people who are HIV negative but at risk for exposure can take to protect themselves. And there is the old tried and true method of choosing less risky sexual activities or using condoms for intercourse. Together, if used by enough people at risk for the virus, these means of prevention could end the epidemic of new infections. But this is not going to happen unless the appropriate federal and local agencies of government make a huge effort to educate about these means of prevention, promote them, and facilitate access to them. But that effort is not going to happen unless the communities affected by HIV stand up and demand it. AIDS is not history until we make it history, and the time to make history is now.